Hello, welcome back to my channel. Today I will discuss with you regarding another speaking role play which is based on hospital. So mostly the students have done mistakes and being confused when there is role play regarding bystander. So today I am going to tell you regarding the same role play which is regarding the bystander. So here background is you see the son and daughter of a 78 years old woman who was admitted to the hospital 3 weeks ago and vomiting and diarrhea. You have been seeing her due to reduced mobility and increased fall risk. The patient will soon be ready for discharge, but the son or daughter would be like to see you about his or her mother's recovery. His or her mother is not present for the discussion. So in 3 minutes time we will get, and in that 3 minute time you have to check out what is the setting and the background history. From the background history we can get to know that it is a known case or an unknown case, or it a directly conversation with the patient or the bystander. So please during that 3 minutes check out this background history, and along with that also the task, different types of verbs check out, and so that it will be easy for you to start your conversation without any hesitation. Okay, now we'll start with the role play. So as it is a bystander role play, so we have to check out the mother's name, and suppose here the mother's name is Susan and the daughter name is Elizabeth. So we'll start with the introduction. Good morning, my name is Raman Gill, one of the registered nurses working in this hospital. So we can say, are you Susan's daughter? So because here is a case of daughter or son, so I will take as a daughter case. Okay, so are you Susan's daughter? May I know your name please? Okay, so we can also say, are you Susan's mother? Or we can also say, may I know your name please? So this is the format how we can verification the name of the bystander. Okay, so next is first task will start here. Find out reason for son or daughter's request to see you. So now here we have to find out. So we can say as how may I help you, Miss Susan. We can also say like this, or we can also say uh, actually here Susan is the mother name, so we can directly talk with the daughter. So sorry, we can say, how may I help you, Miss Elizabeth? Okay. So or we can say, so Elizabeth, you requested me to see, is everything fine? So this is another sentence which will be helpful for you to make a relationship with the bystander. Okay, so we can say like this. So next is the second task. In second task it say, explore specific concern about the mother's recovery, bracket mobility, falls or independent, etc. So for this, we can firstly acknowledge the bystander. That means we give some insurance, initial insurance, which is very important. So we can start the conversation like this. I totally understand you have concern about your mother's recovery, specifically her mobility, fall or independence. So like this we can say to the relative or bystander. So we can ask the specific concern. Okay. So next we can also say that here we are ensuring or providing insurance to the bystander to reduce their anxiety. Okay, regarding their mother's recovery. So and also we can add on along with this sentence, we also add like this. as your mother is admitted to our hospital from the last 3 weeks with the diarrhea and vomiting, and you are here and I am here to see her as she has reduced mobility and increased fall risk. So, in this, merely avoid compound sentences or leading sentences because it will make confusion between your conversation and there will be some of the relevant data will be missed. So, okay, so with this, you can easily make a short sentences to do your conversation. So like this second task is mainly explore means we have to find out any kind of concern regarding the mother's recovery from the daughter. Okay, next is the third one, that is make recommendations for mother's recovery. Example is getting patient to move around more each day, walking short distance, increase gradually, and then gentle exercise, etc. So firstly I will focus on this point only. So we can say, Mr. Elizabeth, let me tell you some recommendations for your mother's recovery. That first of all, you have to get your mothers to move around daily. It will improve their mobility, and also along with that, make her walk for a short distance, and after that gradually increase it. And along with this, you can also start some gentle exercises for your mother. So is that clear to you? So after this all discussion, we have to ask the understanding of the patient, relatives or bystander, that what all the things we have or what all the suggestion or recommendation as a nurse we are giving to the bystander, is they are hearing or is they have understand what we have told them. Okay, so next point is describe some specific exercise recommended by the physiotherapist. Example, sit to stand, heel raised, stepping up onto a step, etc. Find out if his or her mother lives alone. Okay, so now next point is also regarding the description. So we can say here that I would like to tell specific exercises that was recommended by the physiotherapy, like sit to stand. First make your mother sit and after that stand. Again next it will be sit and then stand. So like this you have to help your mother. And next is heel raised. So and another one is stepping up onto a step. So like this short exercises you have to help along with your mother to do these exercises. Okay, and don't worry, physiotherapists will visit you soon and explain you in better way. So are you clear with this? We can also ask the question. And next is find out if his or her mother live alone. We can also ask from the bystander that her mother is live alone. So we can say like this, could you please tell me that your mother lives alone? Then the bystander will say yes. So then next we can uh, explain the patient's relatives, that is bystander, regarding exercises because it is very important for her. Okay, so we can move toward the fourth task, that is stress important of exercises. So here we have to tell the importance of exercises. So we can start this sentence like this: exercise, Miss Elizabeth, exercises is very important in your mother case as it will improve her strengthen and balance his body, and also along with this you have to increase, and along with this exercises will help in increase the range of movement of your mother. So like this we can construct the sentence. And next is emphasis appropriate exercises for his or her mother like walking, swimming, etc., and find out any other question or concern. So we can also say if we can also um, make your mother to do like easy exercises, walking and swimming. If she is okay with that, then only you can encourage her to do. Okay, so at last you can also ask, find out any. So do you have any other question or concern? So then the relative will say regarding the footwears. So at the last task is advised and appropriate footwears. Okay, so as a nurse we can suggest, and it say we can construct the sentence like this: it is advisable for your mother to wear appropriate footwear for proper ambulation, and please bring it to the hospital, and when your mother is in the hospital you can use for her in the hospital that footwear, and when once she will discharge, then please take this back to the home and wear this footwear to reduce their fall risk. Okay, so guys, I hope this all points I have make a short sentences and tell you shortly that it is very easy to construct a sentence with appropriate verbs which are used in the task. Okay, so I hope you all clear with this. So please contact if you require any help. And at last we can ask from the bystander that if they require any kind of help, so please contact if you require any help. Thank you for your